Well, good morning, everyone. Welcome this morning to our live, and we are happy to say hello to a few folks here this morning, as many as I can see. And as you get your notifications, welcome, welcome, welcome. Michael from Norland. Mike, you're number one. Brahim, you're number two. From Portland, Oregon. And let's see, who's number three? Andrea, I knew it. Niagara Falls. Janice, you're right up the top. And Terry, how are you? Jude, Troy, New York. Arlene, good morning. And Louise, good morning. Fran, Orangeville. Wendy, good morning. From Markham. Nick, from our staff. And Nina, Cecilia, Manitoulin, Cary, Nebraska, Laurie, Niagara Falls, and Bonnie on Manitoulin Island. And Brahim says he sees Kevin. I didn't. Sandy, Washington. And, I can't see it. Bev, how are you? Margaret. And Paul, how are you from Edmonton? Maria. And Cheryl, West Virginia. Man, that wants me to sing this morning. Terry. Lisa Marie, good morning. Diane, how are you? And Betty Lynn from Brantford. Sherry, that makes me sing. Dorothy, how are you from PEI? Malou, Irene, and Donna from Newfoundland. Evangeline, Cape Breton. There's Kevin. How are you, buddy? From Oshawa. Nancy. And Nancy says, I always miss her. Luella, West Tennessee. Gertie from Burlington. Angel, Hamner. Bonjour. Rita, Wasaga. Barbara, Cape Breton. Robin from Connecticut. How are you? Nellie, good morning to you. Annette, how are you? And Jeanette, how are you? Bonjour. Donna, Bell Valley, good morning to you. What time if there's interest? What are you talking about there? Francis. And Melika. And everybody's saying hello to each other. Jose, how are you? Diane, Thunder Bay. Yvonne, Petawawa. Always good to have you on, guys. Rosalinda, I didn't mean to miss you. Carol, West Virginia. Margie, Kansas. Jeanette, how are you? Couple of more, guys. There's Doc McEwen. And Verna. And Olive, how are you? And Elaine, good morning. Linda, Uppsala. Adeline. Mandy. And Donna. Two more. Went by real fast. I couldn't see it. Sandy. Dave, how are you? Rosa, good morning. Well, let's get back, guys, to the questions. And we all want to say hello to Yolande, who's in the hospital. She had that fractured hip. And I promised I'd keep you guys updated with her. And so on behalf of Yolande, I'm saying thank you for all your prayers, guys. Okay, now, question going back. Jim was asking, has Dr. Martin done any studies? Well, on rapamycin. Now, rapamycin, I remember reading about this years ago. They discovered a certain soil bacteria. And I can't even remember what year it was. I'm going to say 1964. I could be wrong. Anyways, and they used it as an antibiotic, an antifungal. It's now used as from what I can see, they've used it as for immunotherapy. And so I haven't done any studies. I've looked at some studies, Jim, and I think they're even with the immunotherapy are looking at some cancer treatment with that soil bacteria. And the problem is you can't get it over the counter. You need to have a prescription for it. And I just don't know how prevalent it's used here in North America. It's a good question. If any of you guys know that, you might want to post it. I'm trying to think how much they actually use it anymore. I'm not sure about that, okay? And if you know anything more than I do, you can post it. Okay, good question, Jim. Fern's asking about Bell palsy. Well, Bell palsy, and what do you think caused it? Well, here's my Bell palsy, by the way, is a partial paralysis of the facial nerve, cranial nerve. And in my opinion, okay, I think I'm right about this, it's a perfect storm. You just don't get Bell palsy unless a couple of things have happened. One, you're lot of stress, could be post-viral, but it's usually a perfect storm of that. And that Bell's palsy, that paralysis, I seen a number of cases over the years when I was in practice of it. And it's usually a combination of things, okay? And there seems to be more frequent after the vaccine, but I haven't seen any studies on that. I've read a few articles about it, that some people developed a Bell's palsy. And again, it's no fun. Sometimes it goes away. Sometimes it's permanent. I've seen it where it's permanent, but it's usually a perfect storm. It's not one thing, it's a couple of things. And if there's stress, post-viral, whatever, that combination, it can happen. I'm a big guy on, usually when I saw it, if there was any deficiencies, I saw it in nerve deficiency, in low levels of B12. I saw low levels usually of magnesium. I saw low levels of vitamin D. Those are the things generally that I saw. Okay? And so I would treat the deficiencies of that. So that's Bell palsy. No fun. Chelsea, what about plantar's warts? Well, viral. Okay? And I like to tell patients to scrape them down, oil of oregano, antiviral, antibacterial, antifungal, antibiotic, natural, a viral killer, oil of oregano. Okay? Scrape her down, get the oil of oregano. Scrape her down, get the oil of oregano on it. Antiviral, right on the plantar's warts. And Chelsea is asking about that. Okay, Chelsea, thank you. That's my go-to for that. And internally, you would take probiotic. And anything, like you want to make sure your vitamin D levels are good. Very important for that too. Okay? Now, Sida, okay? I think I'm pronouncing that right, or Sayeda, okay? Maybe you could let me know how to pronounce it, is asking a good question. He or she, that I don't know either, okay? I heard it's not safe to take iron with the multivitamin. Well, It's not that it's not safe. I don't agree with that. I mean, what's the issue? A lot of multivitamins have. Look, I'm not big on iron unless it's the right type. Okay, that's why we use, for example, in our multi-nutrient, we use an iron biglycinate. It's already been chelated. It's ready to be absorbed. And you're not going to get, you know, where they talk about a toxic overload of iron? That's usually because you got a liver problem. And you usually got a liver problem because you got too much fat in your liver. So fatty liver. They don't talk about that so much, but I do. Okay? And because we're seeing so much more of iron accumulation today. Now, ladies on the opposite end, they often have low levels of ferritin, and often, not always, but if you're a Casper the Ghost, white, pale, anemic, there's nothing better than our multi-nutrient. Nothing better. Nothing better on the market. It ain't even close, guys. And that's why that product is so popular. Okay? Formerly called Blood Boost. I gave it to thousands of patients when I was in practice, and that formula is gold. Okay? And we go read the reviews on it. It's incredible. Okay? But we use an iron in there that's called biglycinate, and I do it for a reason. Okay? Now, when you eat a steak, you know what you get? Heme iron. Okay? Is that good for you? You bet your boots. But when you want to put it in a liquid, you need that biglycinate. Okay? I just know that from formulating over the years. That the biglycinate form is the one, you never get toxic on it. It's the one that's most absorbed. And but the heme iron is the one you get from steak, and heme iron is the one your body needs too. Okay, so anywho, and then he says second part, or Sieda asking me second part, and it's also not good. And this is what they heard. Okay, be careful what you hear. I'm glad you're asking me, Sieda, because I'm going to straighten this out, okay? I heard it's not safe to take iron with a multivitamin. First of all, that's not true, okay? And if you're just taking an ordinary iron, I don't like those particularly. And then it's not also good to take magnesium in iron in the same formula. Why is that? Why is that? I don't understand the connection. I really don't. I've been using this formula in my okay? Multi-nutrient, I call it. Because it's not just a multivitamin and minerals. It's got everything in there. But the magnesium and iron, what's that doing when you take them in a formula? I don't know. I've never heard any contraindications to that. You'd have to show me studies that show me that. And guys, I would never believe it because I've used it too. We have magnesium in our multi-nutrient. But to use them together, I don't understand what the contraindication would be. I just don't see it. Okay? But you show me studies, I'll look at it. Janet, what is a good LDL number for an 80-year-old? High. Janet, you know what a good number is for LDL? High. What's good for HDL? High. What's good for total cholesterol? High. Why? Okay? Why? You need cholesterol. Your brain needs cholesterol. Every cell in your body needs cholesterol, Janet. This whole thing on measuring cholesterol drives me crazy. Now, it's not that I don't look at numbers. I do. Okay? I do. I want your triglycerides to be low, and I want your HDL, to be high. And I don't particularly look at LDL, because I'm not interested in the number as long as it's high. You want high cholesterol. You don't want to get your cholesterol down. And they've made LDL, Janet, the boogeyman. Why did they make it the boogeyman? Because they found a medication that lowers it. It's been the greatest hoax in the history of medicine, is lowering cholesterol. Well, if it only did anything, if it only worked, for heart disease is worse than ever. And I love cardiologists, but did they ever get anything right? They went after butter. They went after meat. They went after salt. Has it worked? Right? They wanted you to eat margarine. They wanted you to cut down on eggs. They wanted you to cut down on butter. Has it worked? Heart disease is worse than ever. They wanted you to get your cholesterol down. Has it worked? Heart disease is worse than ever. It's looking for love in all the wrong places. And we've been consistent about it. Anybody that's followed me for any length of time, and I've been public for a long time because of my radio show and writing books. Cholesterol is not the boogeyman. Cholesterol is at the crime scene. Yes, it's at the crime scene, but it's the good guy. It's the fireman at the fire. They're trying to put out inflammation. It's the police at the crime scene. It's not the bad guy. And that's why, I should actually write a book about this, saying, you can't make me care. I always tell people like that, because every day it happens 7 days a week, guys. I was talking to somebody the other day and said, well, listen, every day, our response to our podcasts, our response to the lives, every day, we have a community just on Facebook of over 82,000 people on Facebook. We have a private Facebook group that's over 20,000. Questions every day. We appreciate it. That's why we have a group. That's why we have a Facebook following. We don't mind answering your questions. That is why we have Question and Answer Friday. Often, Question and Answer Monday. You can ask. But I've never changed my mind on this. As a matter of fact, I defended LDL years ago. I said they made it out to be a bad guy, but what I knew in biochemistry is that LDL is a carrier. HDL is a carrier. You need it. It's on the highways and byways of your blood vessels, of course. Of course. They're carriers. And one thing we're finding out about LDL today is that it's a part of your immune system. LDL needs to be defended. Everybody, not everybody, but just about, in medicine is trying to knock your LDL down. They're trying to knock it down. Why? And then I knew they would do this. I knew that years ago. I predicted they would do it. They would then they start talking about particles. So LDL, lipo, the small part, the smaller particle and all that. One's bad, one's not so bad. And it's all, to me, put into the confusion category. Look, statin drugs are the #1 selling medication of all time in terms of revenue. People take it. Why? My doctor said so. Okay? I've talked to thousands of people. I said, why are you taking that? Well, I don't know. My doctor said. Did you study it? You study the side effects? Do you know what's happening to you? Now, I never told people to come off medication. I wouldn't do it. I wouldn't do it. I remember having conversations with cardiologists. Conversations. If someone has a heart attack and their cholesterol is normal, do you still give them a statin drug? Yep. Why? Well, it's part of our cocktail that we give them, even though their cholesterol is normal. Yep. It's so ingrained in medicine. Cholesterol is so ingrained in medicine. And I can tell you in Canada, and I can't talk about every province, but I can tell you about our province, the College of Physicians and Surgeons would have a conniption from any physician that would hesitate to give their patients, especially cardiologists, a statin drug. It's so ingrained. I'm not optimistic that's ever going to change. Even though we have social media and we have shows like mine and they're talking about just information. Doctors do this because they're trained like this. Do you want to have a heart attack? No, of course, doc. I don't want to have a heart attack. Well, then you need to take a statin drug because your cholesterol is high. As a lay person, that's hard to argue with. Can you imagine? Somebody goes in, a medical doctor says to take a statin drug, and you're going to have a heart attack if you don't. It hasn't reduced heart attacks even an ounce. Not even an ounce. But you can't change the narrative. You just can't change it. And I don't care how old you are. You get scared skinny by cholesterol. It's so ingrained. Why do you think today, one of the reasons they don't want you eating eggs, meat, and cheese? Because you can only eat cholesterol in animal foods. Cholesterol is not found in the plant kingdom. So every day, 7 days a week, I answer questions about cholesterol. And a lot of times I do it publicly on this program. And I guarantee I'm going to have to answer again and again and again and again. But I'm being consistent. Here's the numbers I'm interested in. Okay? You can't get me interested in LDL, the number. I don't care, as long as it's not low. Okay? If it's low, you're in trouble. Okay? I like triglycerides. And I want your triglycerides to be lower than your HDL. That's the one I'm more concerned about. I want low triglycerides and high HDL. That's what I want. Okay? And that's what you should have. That's what I'm concerned about. That's science of cholesterol. And your body makes cholesterol. And if you insist on having low cholesterol, well, good luck with your brain. Good luck with your hormones. Okay? Guys, I ask the questions. I'll just reinforce what I am talking about. Janet, thank you for the questions. Linda, what is the difference between A1C and pricking the finger number? Finger pricks randomly at 5.1. Well, your finger pricks, Linda, here's the difference. A1C is an average of your red blood cells that are glycated by sugar. Okay? I like A1C for a reason. Your finger prick, I don't care if you do it. I'm not as interested in that. That's your blood glucose levels. Okay? And blood glucose is tightly regulated. Tightly regulated. And when your blood glucose goes high, and it stays high, that's diabetes. But that's not the first thing that happens. The first thing that happens is insulin response. A1C gives me a better idea of that. A1C is an average of 3 or 4 months of your red blood cells being glycated by sugar. It'll give you a much better indication of how your insulin is reacting to that. Okay? So when you prick your finger, yeah, it gives me information. You know, I did every test under the sun in my office. I like blood work. Okay? I like the lab. But I wasn't too interested about your blood sugar. And people go, what? Well, I'm not too interested in that. It doesn't mean I don't look at it, but I'm not that interested. I'm more interested in your urine sugar. What? Yeah, because if you're spilling sugar in your urine, you're in deep doo-doo. It's really telling you that you got a real problem with sugar. It's how they used to diagnose sugar diabetes. How did they do that? Urine. You could smell the urine, the sugar in the urine. I used to test for that. Okay? It was very simple. Chem strips. I got them right here. And I would look for glucose. That was the 1, 2, 3, 4, 5, number 6 on the chem strips. Okay? See that? I used to do that in my office. Much better indication of diabetes. It will tell you early, not late. Blood sugar will tell you late. Urine sugar will tell you early. A1C will give you a better indication of insulin resistance, which I'm really big on. That's why I liked A1C. If it was over 5.4, you got insulin resistance. You're not doing well. So that's why I'm not against pricking your finger and taking your sugar. Some people, like you're a diabetic, they're always monitoring their sugar. Okay? They're always monitoring it. I'm not that big on that. I think you do it too much, in my opinion. If you eat right, if you're a diabetic and you're eating eggs, meat, and cheese, you're going to do much better. And you can monitor your blood sugar. If you're eating the wrong foods and you're monitoring your blood sugar, you're not fixing anything. You're just constantly, your blood sugar going up and down and up and down and up and down. And you're not in control and you're using medication to control it. That will end poorly. That's my experience with that. It's going to end poorly. There's only a certain amount of time that you can use medication to control blood sugar. It ends poorly. The prognosis ain't great because it's a food problem. You have an allergy to sugar. You know how I look at that. You and carbs don't get along. That's what it means. It's a food problem. It's not a genetic problem. It's a food problem. Okay. Linda, thank you. Judy, what do you think of halal meats? Nothing wrong with that. They're good for you. Halal meats. Okay? Is that how you say it? Halal? I don't know. You know me and pronunciations, I'm often wrong. I read it and, yeah, they're meats. They're good for you. Okay? They still have the same nutrition benefits. Sure they do. They're very good. Any meat's good for you. Okay. That was Judy. Thanks, Judy. Can someone with Graves' disease take ashwagandha? I don't see why not. Ashwagandha, I love ashwagandha. Okay? We use it in our cortisol formula. You want to talk about a popular formula, is our cortisol formula. My word. Unbelievable. And I remember Tony Jr. and I said, let's go back, I don't know, 15, at least that long. I remember sitting down with him. We were talking about cortisol. And we were starting to test it in our office. And holy moly. It was like almost every patient had high cortisol. And it was unusual. It was coming. And I don't know if my practice changed or it was the patients or it was, I don't know. I just knew, man, people are stressed out today. They got that stress hormone coming out their ears. Cortisol. Now, I had been talking about cortisol for many, many, many years. I talked about it when I wrote this book, Chronic Fatigue Syndrome, behind me there, over my shoulder. Okay? And I wrote that book a long time ago, 30 years ago. But then we started seeing cortisol, like I saw it in chronic fatigue patients. I saw it in fibromyalgia patients. And adrenals. I talked about the adrenal glands, and nobody was talking about that. Because we talked about this the other day. The only thing in adrenals that medicine, you could get medicine's attention when it came to the adrenal glands is if you had Cushing's or Addison's. And someone's face would be all puffed up and they say, well, you got Cushing's. Okay, which is an adrenal gland disease. But unless you had a disease, nobody ever tested for cortisol or anything like that. But I saw it in chronic fatigue syndrome, and I knew it was a big problem with them. They got adrenal gland exhaustion. It was very consistent. They had leaky gut, very consistent. They had yeast coming out their ears, very consistent. And I talked about it. And I saw a lot of patients with it. But then again, that was in the 80s and 90s. And then in 2000s, I started seeing a lot of cortisol again. Not necessarily with high cortisol levels, with chronic fatigue, although there was still some. But I saw it. It was much more generalized. And I wrote a book about it. Well, we wrote a book about it. 2 hormones that want you dead. I really saw the connection between cortisol and insulin. They were 2 hormones that wanted you dead. Insulin. That became a big seller. Very popular book. And out of it came the reset to fix the insulin and our cortisol formula to fix the cortisol. Okay? And we use ashwagandha. Can you use it in Graves' disease, which is an autoimmune disease of the thyroid? Yeah, I can't see why not. Would only be beneficial. Whether, guys, it's Graves or Hashimoto's, autoimmune, number one, you got a leaky gut problem. Okay? Oftentimes when I saw Graves in women, it was not only, here's what I found generally. Not only did they have leaky gut, they had estrogen dominance, they had low levels of progesterone, they had high levels of cortisol, and then they got autoimmune. And if you ever take our metabolic storm course, they often were in a category 5 storm, meaning everything was out of whack. And you have to look at these things holistically. Look at the whole caboodle of hormones. The thyroid, like I said, the thyroid, it never acts alone. There's a lot of strings attached to the thyroid gland. And unfortunately, medicine generally has forgotten that. They don't look at the body holistically. They should. They isolate. Oh, you got a thyroid problem. Yeah. But there's a lot of strings attached to that. What's causing it? Where is it coming? Is it coming from the brain, the hypothalamus? Is it coming from the liver? Is it coming from ovaries? Is it coming from the adrenals? They're connected. Insulin is connected. It's all connected. You got to look at all of it. And it's amazing when you balance those things, how much better a patient gets. I'm not necessarily saying a cure, but better. Okay, let me see. Am I done? Yeah, I think I am. I think I did it. Okay, we got them all done, guys. That was question and answer Monday. Okay. And we did a little bit of pontificating today, but that's all right. Okay? I can almost guarantee it's going to happen on every question and answer day. Rabbit trails. Okay, guys, we love you dearly, and we'll talk to you soon.